I enjoy learning about other people's achievements. How did they do it? How can you do it? So for the next 30 minutes, sit back and relax while you and I explore these very special wonders that make people successful and interesting. Welcome to my world, and Dr. Passes presents. So the other day, I'm on the phone and I'm speaking to a doctor who works as a consultant for me when I have some questions in medicine that I need to get an answer. And I'm having a conversation about a patient with this doctor. And as we're talking and we're getting deeper and deeper into our conversation, it just hits me like a bell goes off in my head. And I just say to him, I say, Dr. Klein, I would like you and I to have these kind of conversations for the public on TV. What do you say we do this on TV and we have the public get a good chance to understand more information? After all, information is power. And my good friend, Dr. Klein, said to me, I'd love to do it. He's a terrific guy. He's extraordinarily informed, and he agreed to come down. So I want you to sit back and relax. You might want to get a pen and some paper, because this is going to be one of those shows where you might want to write some things down because you're going to learn a lot. It's going to be fun, informative, and interesting. So before we continue, without further ado, I want to bring to you Dr. William Klein. Dr. Klein.
Thank you. Pleasure to be here.
Well, it's great to have you come down here because you are a very busy guy. You got a very busy practice, and I'm thrilled that you took the time. And instead of just you and I talking on the phone, we'll do it here in front of a whole lot of people. Anyway, so let me first tell my viewer a little bit about who you are and your background so they can appreciate you as much as I do. So, okay, Dr. William Klein, let's see. So you did your, you went to Mount Sinai School of Medicine in New York.
Yep.
And actually before that, you were at college at Emory University in good old Atlanta. I fly there all the time. I have an educational center I go to down there, and great city. And then from Mount Sinai, so you stayed at Mount Sinai. From there, you did your internship and your residency after you finished your medical school, again, in Mount Sinai Hospital, and you did your training in internal medicine.
That's right.
Okay, then subsequent to that, you became board certified in that internal medicine. Okay, so that means that's pretty good. Okay, then you decided to come out to Long Island, and you're out here on Long Island, and your practice is in Great Neck. Everybody knows the office. It's called Healthbridge / North Shore Primary Care, and that's the name of the practice. And you've been there for like over a decade and a half. So you're no stranger to our area here in good old Great Neck and North Hempstead, which is great. And I'm thrilled because I got a chance to converse with you and have a relationship with you. Let's start off first. Why did you pick internal medicine? So many areas you could have gone into.
I feel like I'm in my my medical school days when I was asked, what are you going to go into?
Right.
I think it's a process of discovery, what you're interested in as you go through the medical training process. I learned early on in medical training that I liked the whole patient, not just dividing the patient up into minuscule, very tiny subdivisions or organ systems. I always liked the idea of treating the whole patient and understanding and treating the interactions between the organs and getting to know the patient as a whole person.
As opposed to the kidney in room 3.
Right, and also I found it very challenging to be responsible for diagnosing problems that involve all of the major organ systems, and then to be able to follow that patient clinically over time and to help them and improve their health over time, as opposed to dealing with discrete problems that arise and then see you later.
But there's something I know more about you. You are a relationship guy, and your patients, and I've gotten to know them through time, they have great relationships with you, and that is essential. And if you're just going to be the kidney doctor in room 3, you can't really build relationships, and you get to know people.
It's one of the benefits of primary care is that you're not trying to solve every problem every time you see the patient. You partition, you parse the problems, you you sort of divide up and conquer bits and pieces. Rome wasn't built in a day. Medical care and wellness and health and establishing better health is something that isn't done in one day. It's done longitudinally over a long period of time. Sort of like if you have a favorite car that you just can't get rid of and you want to bring it to the mechanic. You don't want to throw that car out after 2 or 3 years. You want to make sure it's actually being maintained over time and improving it, and perhaps even tweaking the engine and putting on special turbocharger if you're into that type of thing, or if you want to make it into a race car over time by stripping away some of the weight to make it faster. Long-term relationships can achieve miraculous results with patients.
I agree with you. It makes great sense. So let's move on. Let's talk about how I started the conversation, and that is, what is the importance of communication between healthcare professionals?
It is under-recognized. The importance is paramount. It is probably, if not one of the most important, maybe the most important aspect of healthcare. It's important. Why is a good question. I think the reason why communication between healthcare providers, doctors, nurses, dentists, physical therapists, communication is key because one person doesn't see every aspect of the patient at all times. An internist, an internal medicine specialist or primary care specialist is responsible for being a quarterback and trying to see everything, but you need a team, and you need to have somebody in charge of that team who can put together the puzzle pieces, who can help facilitate conversation between patient and specialist, specialist and specialist, specialist and primary care doctor, somebody who acts as a coordinator, because healthcare is complex and becoming more complex, especially recently with advent of very, very sophisticated technologies, and with some of the challenges that are now posed in healthcare by cost constraints and trying to manage people's health in certainly a more economic fashion.
Let me talk about what's near and dear to my heart. I'm a dentist, obviously. Talk about the relationship that exists today as you see it, and the importance of the communication between the dentist and the physician, or the internist, let's say.
Well, I think today it's fair to say that most doctors don't communicate on a regular basis with a dentist, and probably the same both ways. It's not something that's typically encouraged in medical training, and the mouth is sort of something like a no man's land when it comes to medical training, except obviously for ear, nose, and throat professionals. But most of us certainly learned the anatomy, the physiology, but we leave teeth to the dentist.
Right.
And that may be fine, but there are certain conditions, both dental and medical, that interact with each other that would benefit from a clear, concise, thorough discussion between the dentist and the internist, for example, or other healthcare provider, in order to optimize the patient's health. Several different problems are best treated in a tandem approach, having the primary care doctor, internist for example, and the dentist working together at improving mouth health, oral health.
Let's discuss that. Let's stay with that for a minute, if you will. And let's talk about a patient who comes to you and says, Dr. Klein, I have been suffering from headaches. In your flowchart, for lack of a better word, in your mind, how you assess things?
Well, it's called a differential diagnosis.
Differential diagnosis,
right.
Okay? So in your differential diagnosis, do you ever put dentistry in that? And how do you, what do you do with that?
I do all the time, actually. Dentistry has to be considered, or dental problems, dental conditions have to be considered, because your teeth are in your head. And of course, not just your teeth, but the supporting structures, gums, jaw. People tend to forget that the mouth is a complex place. It's got a hinge. Hinge can develop arthritis.
Right.
Hinge can develop inflammation. You've got soft tissue, prone to injury, prone to infection. All those things have to be considered. And when somebody comes in, for example, with the complaint of a headache, I think the first thing most internists think of is to rule out the terrible problem, which fortunately is rare, such as a brain tumor or a migraine and so forth. Once the workup begins in terms of a medical diagnosis, obviously, doctors are obligated and they're used to thinking in terms of big problems and scary problems. But once, as I mentioned before, once the big problem is identified or not identified, and you start working down the list to the less common problems, then frequently a doctor will come up with nothing. They don't have an answer. The patient who's complaining of a headache has gone to the neurologist. They've gone to an ear, nose, and throat specialist. They've gone back or perhaps even seen more than one internist or more than one primary care provider, maybe gone to an urgent center with pain in the head. And after the workup is really done medically, I typically will always think of a dental cause, because there are several common dental problems that can present as cephalalgia, the fancy word for headache, or neck ache or jaw ache, in fact. And that's when I certainly appreciate having on my team a dentist who appreciates the complexity of headache. And I think that's a summary of that thought process.
Right. Another point that is really important to me, and most dentists today, is the use of anticoagulants. I can't tell you, yes I can, you know, in the course of the day, how many patients come in on anticoagulants. It's almost like a vitamin. And talk about that for a moment. Why is that significant?
Well, let me explain to you and explain to the audience, of course, when we say anticoagulants, we mean blood thinners. And blood thinners can be something as simple as aspirin. Could also be supplements. Oftentimes, dentists and doctors forget to ask about supplements that can thin the blood, nutraceuticals, things you buy over the counter, and so forth. But I think also one of the reasons why you're seeing this so commonly now is because we are recognizing more and more the need for anticoagulants in patients who've had stents, for example, cardiac problems, atrial fibrillation, which is a very common arrhythmia, and it's common, and one of the biggest risk factors for atrial fibrillation, of course, is age, and the population is getting older in general. And so we're seeing more and more patients on newer and newer, and in fact, novel anticoagulants that oftentimes dentists haven't seen before. Oral anticoagulants that are not Coumadin or warfarin that most of our audience are probably familiar with. The television airways are filled with advertisements now for new types of anticoagulants. I think the real issue here is, for dentists and for doctors, is it safe to perform dental surgery with the anticoagulants in place? And is it not safe? And what are the risks and benefits? And that's something that generally having a very, very detailed conversation between the dentist, the doctor, and even the patient, and explaining the risks and benefits of going ahead with dental procedures, even cleanings, extractions, dental work, restorative work. All of these things are important for the doctor and the dentist to be very clear about, because anticoagulation, blood thinning, is one of the most serious medical issues because of the ramifications of not anticoagulating a patient who needs to be anticoagulated, or restarting anticoagulation too soon after a procedure. So it's a very interesting topic, and I think it's one of the more common things that I've spoken to you about. And it's interesting, and the part that's so kind of cool about internal medicine is everybody's different. Every patient is different. The needs are different. The cases are different. There are certainly guidelines, but there is room for negotiation in medicine, and the patient should understand that, and they should ask questions of their dentist and their doctor to make sure that they are getting they're not getting short shrift when it comes to the question of dental procedures and blood thinners.
Yeah, that's important, and again, that comes back to the importance that we started the show of communication.
Absolutely.
Doctor, I always make sure that I speak to the patient's physician about this.
Yeah.
I want to move to another subject that I know is a big subject for you, and that is sleep apnea. And what is sleep apnea?
Well, I think what we're really talking about for purposes of today is the concept of obstructive sleep apnea. There are several different types of sleep apnea. I think when the public hears sleep apnea and they hear the story about somebody wearing a mask and looking like pilots of a MiG fighter, you know, and snorting and having a machine going in the background, that's really obstructive sleep apnea, and it is a very common medical condition. Unfortunately, very, very common and not diagnosed. as often as it should be. We're seeing more sleep apnea than ever before because one of the major risk factors for sleep apnea, which is essentially you're choking yourself, not getting enough air during the night when you're sleeping or during the day when you're sleeping if you're a shift worker. And one of the most common causes for this is obesity and overweight status. We see an epidemic now. 2/3, almost 70% of the country is now overweight or obese. You see this also as a dentist. And I'm sure you can even see when you examine a patient a tight airway. Now that's just visible to a dentist's eye, but to an internist and other sleep specialists, pulmonologists, cardiologists, doctors who frequently deal with that problem, sleep apnea it goes further. It's a collapse essentially, or a obstruction, a physical and a mechanical obstruction process of the airway where the patient is not getting enough air while they're sleeping.
So if they don't get enough air, what can happen to them? Well,
this is a very interesting field of medicine. I mean, in a nutshell, cardiac arrhythmias.
The heart can just get weird rhythms.
Can get weird rhythms. Atrial fibrillation, we were talking about the issue with blood thinning. Atrial fibrillation is frequently brought on or at least worsened by apnea. Apnea is a pervasive syndrome of under-oxygenating your body's tissues all night long.
You need oxygen.
You need oxygen. You can't function the next day. People frequently say they wake up and they're not refreshed.
Correct.
And so we have developed treatments in medicine. First, we've developed great screening tools. It used to be you had to go into a sleep lab. And
you do that in your office?
Yeah, we have a sleep lab in the office.
Which is terrific.
It's great, but now we have an even better way of doing this, or perhaps not better, but different, more convenient. It's home sleep studies, and we provide mechanical devices, boxes, computerized devices that patient can use at home.
You sleep in the room with the patient at night?
No.
That's a joke. That's a joke.
That's a good one. But we can have spouses come by, actually, and significant others. But at home, the patient can bring a device home and can be analyzed later and can be found to have sleep apnea, and then we can move forward with refining the diagnosis and in fact coming up with a treatment plan. Now most people think about sleep apnea, they think about wearing that mask, a nose mask, a face mask, and sleeping with a machine, and that's great and it works wonderfully. Some people don't tolerate that. A large percentage of people don't tolerate this sort of feeling of pressure and wind
in your face.
Yeah, and
dries out your mouth.
It can, and you can speak to that for sure.
Yes.
And even though there are technologies to help abate that, it's not always perfect. So there are other ways. Now, one of my favorite treatments for sleep apnea is get out and start exercising and eat carefully and lose weight, because frequently, and this is underappreciated, if you lose the weight and you optimize your health and you perhaps avoid alcohol late at night and other tricks that we teach patients, you may be able to get away with improving that apnea to a point where it becomes more or less clinically negligible. However, in the cases, and frequently it is true that the patients need formal treatment, we can work with the devices such as the breathing devices, or send a patient to a qualified dental professional who can begin the conversation of mouthpieces and dental appliances for apnea.
Let me throw 2 cents in here. So the kind of appliance that you're talking about, which we make, is a device that will go in the mouth and take that airway, that if the airway is all of a sudden constricted and it gets narrow and it's lacking the oxygen, it's stopping the oxygen from getting in as well as you'd like it to, this opens it up and makes it wider and allows the patient to be better oxygenated. And indeed, after we put these obstructive sleep apnea appliances in the mouth, which are very comfortable to wear, I get a call the next day, the patient says to me, I've had the best night's sleep. I can't remember how many years ago. I woke up, I feel refreshed. This is just absolutely terrific.
And I want to interrupt you on that point.
Yes.
Not only do they say that, because I get that too, and whether it's from a mouth guard or a mouth appliance or an actual CPAP machine, or BiPAP machine, which are some of the fancier mechanical devices that we have for breathing assist, the patients function better. The most important thing is they not only feel better, but they have a better day the next day. They're not falling asleep. And I might add, professional drivers, bus drivers, they all know about this because they know they have to pass their physical exams, and if they're suspected to have sleep apnea that's untreated or unrecognized, they can't drive. Frequently, bus drivers are in that position, professionals. I think you have to look at the big picture here, which is it is a public health epidemic. It is intimately related to obesity and overweight status. It's identifiable, it's treatable. It's treatable from a medical perspective, from a dental perspective, and even from a both perspective. You know, and I also have to say, because we, in my practice, are focused on the overall, the internal medicine aspect, we really want patients not just to rely on a machine or on a dental appliance, but we want them to make those other healthcare behavioral changes to get themselves healthier, to lose the weight, to live longer and better. It's not just about the breathing.
I'm going to interrupt you because time's moving, but I want to discuss for one moment. You have a very interesting philosophy on how you practice medicine. Can you tell me a little bit, in about 2 or 3 minutes, about concierge medicine? What is that?
You know, if you ask 10 doctors, you'll probably get 10 answers.
Okay, so give me yours.
My answer is a combination of a lot of professionals' answers when it comes to concierge medicine. Concierge medicine is a way of practicing medicine with fewer constraints on time, both for the doctor's perspective and the patient's perspective. You know, one of the most common complaints that any practicing physician in primary care, or any of the subspecialties for that matter, such as pulmonology or cardiology, gastroenterology, most of the common complaints that doctors have is, I just don't have the time to see the patients. I'm always in a rush. And although we all endeavor to do the right thing for the patient, that feeling of being rushed is a very disturbing feeling for doctors, and it's even more disturbing for patients who feel like they've waited an hour and a half in the waiting room. They had to wait a few days, if not weeks sometimes, for an appointment, and by the time they get to the doctor diagnoses them, listens to them for 2 minutes, comes up with a plan, gives a prescription, nowadays electronically prescribes, right. And the patient's out the door in moments feeling like a whirlwind, not having the opportunity perhaps to ask the questions they'd like to ask and have answered, have a meaningful conversation, not just here's what's wrong, here's the treatment. Concierge medicine allows for both the doctor and patient to have a more relaxed, longer appointments frequently, certainly more intimate contact in terms of their medical care, relationship building in terms of emailing the doctor and phoning the doctor when there's an additional question. Concierge medicine is basically the old-fashioned primary care model.
Dr. Welby.
Dr. Marcus Welby, that type of thing. The country doctor.
Yep.
It's a way of slowing things down, of not rushing, and of making yourself available to the patients in a more real-time fashion. Now, the nice thing about that is that it benefits both doctor and patient because the relationships become more meaningful. Concierge medicine also refers to a fee that's paid to the doctor directly that is not related to insurance payments. In the old days, it used to be called a doctor who didn't accept insurance, somebody who was paid cash and could negotiate. In fact, in the old days, it would be a chicken, it would be a cake, it would be somebody would bake for the doctor.
How do you get change for a chicken? What do I get change?
A couple of eggs. You get a couple of eggs back.
It's a funny thought. Yeah. Well, tell me just a little bit, and we've got only about a minute or 2 or 3 to talk here, but. I've been to your office many times. Your office is absolutely wonderful.
Thank you.
It's also unusual. You have a gym in it.
Yeah.
Could you explain that, please?
You know,
I've never seen that before.
A lot of people are surprised by this, but it's like the common sense sort of office. If you think about it, what does the doctor tell you for your acid reflux, for your apnea, for the fact that you can't fit into your clothing, the fact that you have diabetes or pre-diabetes, another scourge we didn't even touch on, maybe for another time. What does the doctor tell you? Doctor says,
get bigger clothes.
You're right.
No, go ahead.
Elastic waistbands.
There you go.
What the doctor really should be saying, and frequently does, and you can't blame the healthcare, not just the doctor, but a nurse, family members too, say, lose weight, exercise more. But then the patient goes home after that 3-minute visit and says, well, how do I do that? Right. How do I lose weight? Right. How do I exercise? Right. Maybe they've been ashamed and they feel like they wouldn't want to go to a gym, a regular gym. Maybe they don't know how to use the equipment. They don't even know how to start the process. You know, a 1,000-mile journey begins with one step.
Right.
Well, we thought to ourselves years ago, wouldn't it be nice if we had a gym, if we had personal trainers, if we had a nutritionist? And I could simply say, not only would I like you to begin exercising, but I'd like you to go right down the hallway, meet with one of my trainers, meet with a nutritionist, the nutritionist will speak with me, the trainer will speak with me, and vice versa, so that we can have really good communication trying to build you a better body, or you yourself as the patient build a better body. It's kind of exciting because not only can I tell a patient what to do, but I can show them what to do. And
all under one roof.
Yeah, and that kind of ties in with this concierge model, because my patients who are the so-called concierge patients, they automatically belong to the gym. They become gym members at no additional charge. It's all inclusive.
I've been in that gym, and you've got every piece of equipment under the sun.
Yep.
That's unbelievable. You even have trainers there.
Yes.
Yeah, it's just absolutely amazing.
The patients love it.
We're just about out of time right now, but I needed for my viewer to understand that there are some doctors who are doing things today that are somewhat out of the box thinking. And that's where you are, and your partner, Dr. David Ellison. Great guy. He's been on the show here, and I really enjoyed speaking with him. Both of you guys are really terrific. I love what you've done, and it's exciting to me because I find what you do to be motivating and inspiring, so that it makes people want to do more for themselves and to be better. Before we shut down, I'm going to give you about maybe a minute. Can you give my viewer any kind of last-minute tip on health to tell them, so that they can shut the show off and say, okay.
Wow, that's that. Yeah, I have to say that may be the first time I've ever been asked that question, a last-minute tip. But I'll tell you what I tell my patients.
Go ahead.
Is read, get educated, ask questions. It's the most important thing. Have the dialogue, both with yourself, your family, and your healthcare providers, your physicians, the people who are responsible for helping you attain better health. And remember another thing, is as a patient, primarily you're responsible for the decisions you make, and you have to make the proper decisions and learn how to make those decisions, because it can't be done for you. Your healthcare team can help you, but you have to make the decision to get better and to maintain your health.
I like that. As a matter of fact, I'd like to speak to my viewer for one moment, and if you have any questions at all that you would like to ask Dr. Klein, you could email him at www.healthbridge, like the word health and bridge.
Info.
Is that
it's healthbridge
healthbridgeinfo.com. And this way, any medical questions, he'll be happy and thrilled to give you an answer. So that'll work really well for you. Anyway, I got to tell you, we're out of time.
Flew by.
Did it go by fast?
Flew by.
Are you going to come back again?
If I'm invited.
You are invited. I've got it right now. It's memorialized on the tape. So you're going to be coming back throughout the year. So we're going to go over interesting things that I believe that my viewer will be thrilled about knowing. And you're such a wealth of information. And this was just like a little appetizer. So Dr. Klein, I want to thank you very much.
Thank you
for coming down here.
Thank you. It's been a
Absolute
pleasure.
pleasure. I want to thank you for taking the time to watch the show. Look in the future. We've got other great shows for you that you're going to learn an awful lot about yourself, whether it's in medicine, dentistry, or even, who knows, maybe food and wine. We do a lot of that around here as well. So not only am I thanking you, but I also want to thank my director. My director is a wonderful, special person, Philip Passis, who's also my son. Thank you very much. We got to go. We're out of here. Dr. Passis saying, see you again next time. Take care.